and a 5 for the average adult male patient. You'll need to consult the sizing chart provided by the manufacturer of the device to select the correct size. To prepare for laryngeal mask airway insertion, you'll need an appropriate sized device, a 20 to 40 milliliter syringe, lubricating jelly, and tape. Often, laryngeal mask airways come pre-packaged with an inflation syringe and a small package of lubricant. Prepare the device by first removing all excess air from the bladder. Then lubricate the posterior surface of the cuff to facilitate easy and smooth passage into the mouth. The posterior surface is the side opposite where air exchange occurs. The following sequences will demonstrate the placement of laryngeal mask airway in consenting adults undergoing elective surgical operations. With the patient in the supine position, gently tilt the head backwards to facilitate placement. Do not perform this backwards tilt in an unconscious patient in whom a neck injury is suspected. Place a straight laryngeal mask airway, open the mouth as fully as possible, and insert the device into the mouth, directing the posterior cuff against the hard palate. Continue with this motion until you feel the tube's cuff pass behind the tongue completely, and then until you meet resistance. Successful insertion depends on keeping the leading edge flat to prevent the cuff from folding on itself and exerting firm pressure against the hard palate during passage. Inflate the cuff with approximately 30 milliliters of air. During inflation, the shaft of the airway often moves out of the mouth 1 to 2 centimeters as it finds its proper location. The cuff should not be visible when the tube is in the proper position. The final resting position is posterior to the tongue at the laryngeal inlet, as shown in this illustration and in this fiber optic view through the distal end of the device. This cutaway view of the head and neck illustrates the path taken by the laryngeal mask airway during insertion and where it rests following insertion. Key structures are labeled to illustrate the relevant anatomy. Use of a pre-curved laryngeal mask airway sometimes allows placement without the need to insert hands inside a patient's mouth. To place a pre-curved laryngeal mask airway, grab the connecting tube with your dominant hand so the cuff points to the patient's head. Your hand should be in a neutral position with the thumb on the upward surface of the tube. As with the straight tube, guide the laryngeal mask airway above and behind the tongue by applying firm pressure along the patient's hard palate. Guide the tube behind the tongue and toward the larynx with a circular motion of the hand. After placement, inflate the cuff